So the background of the Scottish conservation trial was this was a historical trial initiated by the late Professor Sir Patrick Forrest in Edinburgh in the 1980s, and was a randomised trial in which women under the age of 70 with tumours up to 4 centimetres underwent breast-conserving surgery, appropriate systemic therapy based on their estrogen receptor status, and then were randomized to either radiotherapy or no radiotherapy to the breast and or regional nodes. And in the initial publication of the study in The Lancet in 1996, the addition of radiotherapy reduced the risk of local recurrence within the breast by a factor of 4, but there was no impact on overall survival. We have undertaken what we believe to be the longest follow-up of a breast conservation trial of similar design, very recently of the same trial, which gives us follow-up up to 30 years. Now, in the Oxford overview of randomized trials of breast-conserving surgery with or without radiotherapy, published in 2011, it was shown that radiotherapy reduced the risk of first recurrence, either in the breast or at distant sites, by just over 15%. And that corresponded with a modest reduction in breast cancer deaths of just under 4%. So it was thought that there was a relationship between reducing local recurrence and reducing breast cancer deaths. So in this study, we showed that radiotherapy does indeed reduce local recurrence, and it does so by 60% over the 30-year period of follow-up. But our main observation was that actually most of the reduction in local recurrence occurs in the first 10 years of follow-up. And in the Oxford overview, the first recurrences were truncated at 10 years. So there was very little data on what happens beyond 10 years. And what we observed, which we might not have anticipated, is that between 10 and 20 years, the risk of local recurrence is the same in the irradiated and non-irradiated group, but the risk of recurrence per year is small, and it's less than 1% in both the irradiated group and the non-irradiated group. When we go out to 30 years, paradoxically, there's an increase of local recurrence at 30 years of 12% in the irradiated group compared to 5% in the non-irradiated group. And that's a paradoxical finding, although the numbers out at 30 years are small and the confidence intervals are wide. We also showed that whether you have radiotherapy or not has no impact on overall survival at 10, 20, and 30 years. And whether you have radiotherapy or not makes no difference to the risk of distant metastases. So those were our main findings. So in terms of implications for practice, I don't think it changes the indications for post-operative radiotherapy, because we've shown that over a sustained period of time, over 30 years, there's a 60% reduction in risk of recurrence. But I think it's useful information to patients that although there is a substantial reduction in recurrence, the risk of recurrence varies over time, so that most of the benefit is conferred within the first 10 years. There is still benefit beyond that, but it's very much smaller in the period between 10 and 20 years, and the risk either with or without radiotherapy is less than 1% per year. But it's not the same, the risk of recurrence doesn't remain the same over the whole period of 30 years. So I think it should reassure patients that radiotherapy is effective over a long period of time, but the relative benefits over time of radiotherapy vary and are conferred predominantly in the first 10 years of follow-up.